partners in Africa, and hopefully that was reflected in the priority we put on negotiating this MOU with you all, including the size of the MOU and the commitment. We're very excited. This is a new day for how we partner in the health sector, really about, as the ambassador said, ending the parallel delivery systems that we've had and having a unified plan together where we really support you in your vision, because you guys have a very strong vision for where you're taking your health system. So thank you for all the work. We know in many ways this is just the beginning of the journey and the real work starts now, but we're really looking forward to it and just so grateful for all your team's effort over these past few months.
Thanks a lot. Give a vote of thanks because the interventions are going to the health sector and she's our boss today. Thank you.
Thank you. Honorable Matia Kasaija, the Minister of Finance, Planning and Economic Development, Your Excellency, the U.S. Ambassador to Uganda, Mr. Brad Smith, the Senior Advisor on Global Health Security and Diplomacy, all the teams from the U.S. government, both based in the U.S. and in Uganda, the permanent secretaries, my teams from the Ministry of Health. Good morning to you all. Allow me first of all to start by congratulating both governments on the signing of this MOU that has taken us a bit of time and a lot of work has been done. And I want to say a big thank you to all of you. It's not been easy. I acknowledge the dedication and commitment from each and every one of you and the tough times we went through. Thank you, Excellency, for your resilience and listening to us. So today is not just about signing a document. It is about sealing a transformative 5-year partnership between the Republic of Uganda and the United States of America, valued at approximately $2.3 billion in both budget and off-budget support. And I will explain this. Slightly over $1.7 billion US is coming from the United States of America, and $500 million US will be coming from the Government of Uganda. That is how we come to the 2.3. I know all of you are asking questions, especially the press. So you need to get it correct. And if you want the exact figures, the permanent secretaries can provide that to you. This is a huge bilateral health investment to Uganda, a powerful testament to decades of friendship and resounding vote of confidence in our national vision and leadership. For generations, the U.S. partnership has been instrumental in our fight against HIV/AIDS, malaria, maternal and child mortality, and emerging infectious diseases. Today, we elevate that relationship from traditional aid to a strategic, sovereign-driven partnership that fully aligns with and accelerates Uganda's own health sector development plan. This collaboration delivers two complementary streams of support. One is predictable, flexible budget support that empowers Uganda to recruit and retain health workers, upgrade and maintain infrastructure, and plan strategically for the long term. And two is off-budget support that guarantees essential medicines, commodities, cutting-edge technical expertise through implementing partners. It is off-budget, but with full knowledge of the permanent secretaries. Together, these resources will build a resilient, responsive, and sustainable health system owned and led by Uganda. The COVID-19 pandemic and our repeated successful containment of Ebola, Marburg, and Sudan virus outbreaks have taught the world a clear lesson. Pathogens respect no borders. Uganda has repeatedly served as the global first line of defense. Our ability to rapidly detect, diagnose, and contain outbreaks is a global public good. A central pillar of this new collaboration is therefore a modern, respectful framework for sharing data and related information for public health purposes. And to be more unequivocal, Uganda's sovereignty over its biological resources and health data is invaluable and non-negotiable. We have left behind outdated, extractive models of the past. All sharing will rest on three non-negotiable principles: mutual benefit and equitable access to resulting knowledge, vaccines, and therapeutics; prior sovereign consent, full transparency, and compliance with Ugandan laws and ethics. 3 is timely, responsible action towards emergencies to protect both Uganda and the world. This framework proves that respect for national sovereignty and global solidarity are not opposites. They are the very foundation of a trustworthy cooperation. So what will this historic partnership deliver for Ugandans? There will be more doctors, as you heard from His Excellency the Ambassador, nurses, midwives, and community health workers who are well trained, motivated, and equitably distributed. Upgraded laboratories, functional health facilities throughout the country, and resilient supply chains. Stronger disease surveillance, diagnostic capacity, and rapid response readiness. There will be a renewed momentum to mitigate HIV/AIDS as a public health threat, eliminate malaria, and march confidently towards universal health coverage. We shall have healthier mothers and children and a stronger shield against future pandemics. To the government and people of the United States, your extraordinary generosity reflects our shared humanity and a joint investment in a safer world. We are deeply grateful. To the people of Uganda, this partnership belongs to you. We, your government, are fully accountable for translating these resources into tangible improvements in your health and lives. And as you have seen, it is the permanent secretaries who will implement this, who have appended their signatures as initials to every page of the document. Therefore, today marks the beginning of 5 years of intense, focused, and results-driven collaboration. Let us therefore waste no time. Let's move immediately from this ceremony to action, from commitment to delivery. I thank you all.
A few questions here at this meeting. Thank you.
Very good.
Yes. Honorable Minister, our meeting comes to a close in Uganda, but our meeting is closed today. Thank you. That's a cooler side. Yes. Yes. Honorable Minister, Director Maris, we have a photo. Mr. Shaba? Yes, we have a photo with the Ambassador and the Honorable Minister. Thank you. you.
Let me introduce you to one of my many
Chris, have a PS.
Honorable Minister, you may take your seats. Between the United States and the Government of Uganda to support the health sector interventions in Uganda. Over to you. Allow us to have a short prayer so that we can start our meeting. Carol, please.
All protocol observed. Good morning. Let's humble ourselves for a short prayer. Dear Lord, we thank you for this honorable. Good morning once again. Let's humble ourselves for a short prayer. Dear Lord Father, we thank you for the gift of life. We thank you for the gift of good health. We thank you for our countries, Uganda and the United States of America. We thank you for the work that has been the signing of this, the signing ceremony of this M.O.U. and its implementation going forward for the good of the Government of Uganda and the Government of the United States of America.
Thank you very much, Carol. Honorable in this side.
Good morning, Honorable Minister, Your Excellency.
Good morning, Honorable Minister, Your Excellencies. I'm Richard Kabagambe, Minister of Health Planning.
Minister, Your Excellencies, my name is Paul Mwanja, Commissioner in the Ministry of Finance.
Honorable Ministers, Your Excellencies, Finance.
Good morning, Honorable Ministers and Your Excellency.
Good morning, Honorable Ministers and Excellencies and all our guests. My name is Diana Atwine, I'm Permanent Secretary, Minister of Health.
The Ambassador and the entire delegation, my name is Ramadan Govi, Permanent Secretary and Secretary to the Treasury for Uganda.
For health.
You, my name is Matia Kasaija, Minister of Finance, Planning and Economic Development.
Thank you, Honorable Minister. We shall now
Good morning. Suzanne Tiru, Country Deputy Director of CDC.
Good morning, everyone. I'm Mary Boyd. I'm the Country Director for CDC in Uganda.
Good morning, everyone. Thank you. Paige Armstrong. I'm the Director of our Global Health Center at CDC. Good morning.
Good morning. I'm Matt Bazzelli, the Chief of Staff at the CDC.
Good morning. My name is Mary Borgman. I'm the Global Health Diplomacy Director at the U.S. Embassy with the Department of State.
Good morning, Honorable Ministers and Your Excellencies. I'm Rebecca Bunnell. I'm the Principal Deputy Assistant Secretary from
Department of State.
Honorable Ministers, good morning. Permanent Secretaries, DG, Commissioners, it's wonderful to see all of you and join you. My name is William Popp. I'm the United States Ambassador.
Excellency, Honorable Minister, we shall go straight into Yes.
And then are you going to take it away?
Thank you, Honorable Minister. Your Excellency. Thank you very much, Honorable Minister. Your Excellency Ambassador, you may take your seats. Yes, okay. Honorable Minister.
My colleague, the Minister of Health, Your Excellency, the U.S. Ambassador, officials from the U.S. Embassy and the U.S. related organizations, senior government officials here, ladies and gentlemen, good morning. First of all, let me take the honor to welcome you to this memorable occasion as the Government of Uganda continues to strengthen its relationship with the U.S. government. Your Excellency, I am pleased to sign this Memorandum of Understanding whose provisions will facilitate the mode of collaboration in the health sector between our two governments. For the case of Uganda, I'm happy that this MOU will add another building block to the contributions the U.S. government has always made toward the support for the health sector program and commodities including HIV, AIDS, TB, malaria, maternal and child health, global health security, among others. Your Excellency, you will recall that we were here 2 weeks ago to firm up our input and positions into this MOU. I commend everyone for the efforts I commend everyone for the efforts put in to see this process concluded on the agreed time. I take note of the need to present the spread of emerging and existing infectious disease threats globally, to which the U.S. government commits to support Uganda with a budget to the tune of $1.4 billion of the period 2026-2030. We also take note and commit to the requirement for Uganda to gradually increase its budget to a tune of shillings $500 million over the period as the US budget decreases. I am informed that this collaboration will not only result in disease-specific outcomes, but also improvements in national systems, institutions, and workforce capacity. This is commendable. I welcome the U.S. government's intention to incrementally increase the funding provided under the M.O.U. as budget support, and where other implementing mechanisms are considered, and I am happy that a joint review is provided for. Finally, I call upon all stakeholders involved to live up to the provision of this M.O.U. and make it practical for the benefit of our countries. Your Excellency, once again, accept my appreciation for the support the U.S. government has always extended to the government of Uganda and the people of Uganda. I thank you for listening to me.
Honorable Minister of Finance, Planning and Economic Development, Honorable Minister of Health, Permanent Secretaries, all Ugandan government officials present, and all of my U.S. government colleagues. It is a pleasure to be here, and I want to thank all of the members of the press also for joining us in this very important milestone in the long and productive health relationship between the United States and Uganda. Today, we have just signed a 5-year and together $2.3 billion Memorandum of Understanding for Health Cooperation. This clear and accountable arrangement outlines how our governments will support life-saving services, strengthen systems that protect both our countries, and ensure responsible use of American taxpayer dollars. This MOU reflects the new direction of the America First Global Health Strategy, which focuses U.S. foreign assistance on making America safer, stronger, and more prosperous, protecting Americans from outbreaks, and moving partner countries towards resilient and durable local health systems, and promoting innovation and businesses abroad. Over the past 2 months, Uganda and the U.S. teams have worked closely to shape a framework that advances Uganda's priorities and ensures America's resources are deployed efficiently and strategically. As Secretary of State Rubio has underscored, foreign assistance is a tool of diplomacy, and every dollar must advance shared interests, protect Americans, and deliver meaningful results. And this agreement does that. For more than 6 decades, the United States has remained Uganda's largest foreign assistance partner, helped expand access to health care, strengthen public health institutions, and save lives. And Uganda has helped shape the United States President's Emergency Plan for AIDS Relief, PEPFAR, from its very earliest days. Notably, the very first person who was supported with HIV treatment by PEPFAR was here in Uganda, a Ugandan man that is today 60 years old and thriving on treatment. And this is just one powerful reminder that cooperation between the United States and Uganda saves lives and strengthens our countries in ways that keep all of us safe. But the previous model of American foreign assistance created parallel systems, inefficiencies, and a culture of dependence. And that model is changing. Today's framework builds on our past achievements, but with a significant shift towards self-reliance, national leadership, and durable systems that can prevent, detect, and respond to health threats, whether HIV, tuberculosis, malaria, or other emerging infectious diseases, in an integrated manner instead of a disease-specific effort. For example, Uganda previously relied on a large cadre of program-specific volunteers, and while their contributions were very essential, a fragmented approach limited full integration across the healthcare system. Under this MOU, we will be supporting Uganda's transition to a unified government-led workforce, More than 1,100 community health extension workers have already been trained through U.S. support, and this MOU will continue providing training and equipment as Uganda assumes responsibility for their salaries. These workers, known as CHOOS, will strengthen disease surveillance, expand primary care, and improve community-level readiness. This is exactly what the America First strategy calls for, supporting partner governments to build their own systems, not parallel ones. Under this agreement, the United States will provide $1.7 billion of the total amount to support priority programs, including HIV/AIDS, TB, malaria, maternal and child health, as well as polio eradication, global health security, data systems, laboratory and networks, and emergency preparedness. At the same time, Uganda is committed to increase domestic health spending by more than $500 million over the next 5 years, marking a significant step towards sustainable domestic financing and full national ownership. This MOU also includes several forward-looking provisions: a transition of commodity procurement to the Government of Uganda while strengthening supply chains, training and equipping over 14,000 CHOOS over the next 5 years, significant investment in disease surveillance, improving electronic medical records, interoperability, and real-time decision-making, continued support to faith-based providers and organizations who have played an essential role in primary care, and tapping in to private sector innovations for the healthcare sector. And finally, clear performance metrics and accountability mechanisms to make sure that we stay on track. These provisions underscore a shared objective: a strong, self-sustaining health system that protects Ugandans and Americans alike. This framework enables Uganda to plan with certainty, set its own priorities, and lead implementation in line with Uganda's National Development Plan 4 and Vision 2040. Honorable Ministers, I appreciate the constructive engagement and leadership your government has demonstrated throughout these negotiations. This agreement embodies a forward-looking collaboration built on mutual respect, accountability, and shared interest in advancing global health security. Together, we are taking a historic step towards resilient, efficient, and sustainable health systems that will benefit Uganda, the United States, and the world for generations to come. Thank you.